When you think of birth control, what do you think of? If you're a female, you might think of a pill, a shot, or many other forms of birth control applicable to you. But as a male, I'm curious what would even come to your mind. I know from analyzing the audience that a few of you may believe that birth control is a female's responsibility, but we all know, as they say, it takes two to tango, and in reality, women should not be bearing this burden alone. I'm clearly not a man, but as a woman, it doesn't make sense to me why there are next to no options for male birth control. I stumbled across this topic one day and began researching it in depth, so I hope you all can hear me out. Today I would like to talk about contraceptives in general, the lack of male birth control itself, and why there have been issues in developing a male contraceptive. So first, let's examine the many different types of birth control. According to Women's Health, there are 14 different types of birth control. 11 apply to women, leaving only 3 methods of male birth control. These methods include the pull-out method, vasectomy, and condoms. All forms of birth control, I'm sure, are familiar to most of you. The pull-out method, which does not protect against STD and has a failure rate of 22%, is at the bottom of the barrel when it comes to contraceptives. Vasectomy is a surgical procedure which cuts off tubes in the man's scrotum and is a great option for males of older age who are done having children, but for males of younger age, it becomes a problem because it's permanent, and if you want to have children in the future, you can't do that if you have a vasectomy. So that leaves just one real option, condoms. Condoms have an 18% failure rate and still are not the best form of birth control when not paired with another form of contraceptive. Notice I said when not paired with another form of contraceptive. This will come into
Students
play.
and staff, this is Mr. McFarland.
When I
At this
introduce
time,
my
we're
next
going to
topic.
conduct a safety drill. We ask that you remain in your classroom and teachers should
So
keep teaching
now I want to
until we
talk
announce
about
the safety drill is over. Thank you.
Or why there is a lack of male birth control. Studies from Planned Parenthood show 62% of all females are on some sort of birth control. And as for teenagers, that makes 53%. This is significant because women are most often the sole provider of birth control. Remember when we calculated how many methods of birth control there were? 11 for women and 3 for men. This means there are almost 4 times as many options for women birth control than there are for male birth control. For women, there are various types of birth control. So after all, what is the incentive for a man to wear a condom once a woman is on birth control? There isn't one. According to Scarlet and Gray Free Press, couples are even ditching condoms nowadays. Science behind male physiology shows that unlike women who produce 1 egg per month, the average man makes about 1,500 sperm cells per second. This is why some may argue that the target is much bigger to creating male birth control. But contrary to these allegations, condoms were first introduced in 1855, and the talk about a male contraceptive goes back to 1839. Our Bodies, Our Cells says that female birth control was not introduced until 1960. This is over 100 years after the male condom was first introduced. So why wasn't 100 years long enough to develop a male birth control? So now that we have talked about why there is a lack of male birth control, let's talk about why there have been issues in developing a male contraceptive. So scientists tried to develop a male birth control shot, but the studies came to a halt because men complained of a lot of side effects from the shot. I want to show just 1 minute of this video which explains the study itself.
Closer to a form of male birth control, except the study had to be stopped due to harsh side effects like mood changes, acne, increased libido, and muscle pain, which ironically, if you think about it, sounds a lot like what women go through.
Yeah, I was going to say, welcome
when it
to
comes to
our
premenstrual
world,
symptoms.
right? You guys can't even handle it. You got to stop it, huh?
When this study was published in the Journal of Clinical Endocrinology and Metabolism, it tested the safety and effectiveness of a contraceptive shot in 320 healthy men. This study started way back in 2008. These men were 18 to 45 in age. They were all healthy in monogamous relationships, given an injection, basically of 2 different hormones. And one was a testosterone type hormone, and the other one was an estrogen type, progestin. And what's interesting is that it was 96% effective, but because of the side effects, they stopped the study. And in fairness, a 4% failure rate probably is never going to cut the mustard when it comes to it. There's no way.
So, as they mentioned, In the study, there was a lot of side effects which men didn't want to go through men didn't want to go through these side effects. So as a result of the many side effects that men suffered with these types of birth control, the study came to a halt. Which, no birth control or even medication in general is perfect. There's always going to be some sort of side effect, no matter what medicine you're taking. And the side effects they saw in this study were not that different from other types of birth control you see in women. There are many side effects on many different types of birth control, and there always will be. But like they said in the video, these studies came to a halt because men didn't want to deal with the side effects. Men had a lot of acne due to this, and this is one of the reasons why they didn't want to deal with this birth control. So today I have talked about contraceptives in general, the lack of male birth control itself, and why there have been issues in developing a male contraceptive. It takes two to tango is a simple phrase that many are taught as a young child in learning responsibility. If the saying goes, it takes two to tango, then why are women bearing this burden alone? Why do we still have no viable options for male birth control after all this time? While men can't physically become pregnant, men should regard their significant other's pregnancy as theirs. If neither wants a baby, they should both partake in preventing the pregnancy. What we all can do, and what I encourage you to do as a listener, is to always stay educated and ensure you and a partner are both using birth control equally. Staying educated and making sure that you are both doing this is going to obviously prevent pregnancy even better. As I stated in the introduction, a few of you may believe it is the female's responsibility to provide birth control. But as long as we all can agree that it takes two to tango, we can also agree that there need to be more options for male birth control and finding out a way to make it more equal for both genders. Thank you.